Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Students pursuing a career in dentistry must be prepared to devote 4 full years to learning the profession. Continuous demands are placed on these students throughout their academic training. In addition to the classroom situation, students are also expected to participate in clinics. To further expand upon the expectations of dental students, let's take a brief look at 4 years in the University of Michigan School of Dentistry.
What I like about the school is that I think there's a tremendous wealth of information here with the people that we're working with. They're very skilled clinicians, and I think that with a combination of the research tower and just the good clinical exposures that we have, it's made it a really nice experience. I think that it's not always easy to take in all that's available to you here. I think that's a continuing conflict that student goes through because there's so much to learn that you have to almost kind of weed out what it is you want to get good at.
Freshman dental students take courses in the basic sciences, dental anatomy, and human anatomy. Freshmen participate in a minimal amount of clinical work, including teeth cleaning and patient instruction in oral health.
Your first exposure to preclinical dentistry is probably most of the students, as well as myself, are not fully aware of all of the detail and the difficulty of actually learning how to position yourself, the patient, manipulate a high-speed handpiece. And that was tough. It was tough starting second term freshman year, and then, of course, sophomore year, where you've got 9 credits of preclinical dentistry both terms. I think you're just overwhelmed with as much laboratory work that you have to do and have to learn how to do it. I think sometimes, too, it's difficult when you're dealing with a wide range of instructors who are not always communicating with each other what went on the day before, and sometimes it shifts around, and I think it's a real exercise in patience all the way around.
Various teaching methods are available to all dental students. Tape demonstrations viewed in the classroom and specially prepared workbooks are utilized as instructional aids. The school's Media Learning Center provides these videotape demonstrations for students to view individually.
Sophomore year, you get more into the preclinical, the lab work, and so forth. You manufacture a denture, you make 2 bridges, there's a lot of gold inlay work, and so forth. Freshman year, the only real big lab work you had was, well, some wax-ups and amalgams. So it's quite a transition. Freshman year was more books, especially first semester freshman year. There's still a fair amount of book work sophomore year, but the main pressure comes from the lab work because it just like I said, adds another dimension to what you're working on. So you have to put more time in there where you didn't have to before.
As students enter the sophomore year, their workload increases. Along with the basic sciences carried over from the freshman year, students participate in preclinical laboratory work. This preclinical work includes restorative treatment on models in the areas of operative dentistry, crown and bridge, complete denture, and orthodontics.
It's just the fact that all through school you had to work with your brain. And now you're being made to work with your hands too. So it just adds that other dimension onto it that a lot of people don't have to deal with. If you're reasonably good with your hands, you can slide through a lot better. But there's a lot of small little things you're working on. And a slip up here, a slip up here, there puts you behind a little bit, and you're kind of trying to catch up. Everybody gets through in the end, but sometimes you're spending a lot more time at lab than you'd like to be.
Clinical work includes oral diagnosis, prophylaxis, and simple restorative procedures. In addition, students continue their instruction in the basic sciences and begin studying internal medicine as it relates to dentistry.
I would say the highs, for the most part, come with the patient. When a patient looks at you and said, gee, thanks, I like it. It doesn't hurt anymore, my teeth feel better, I'm satisfied with the appearance, or even more so when they look at you and say, I'm not afraid to come anymore. That, I think, is when you've achieved the most, because that way they're not necessarily ever going to see you again, but hopefully they won't wait until they're in pain to go see someone else.
During the junior year, dental students devote 20 hours a week to patient treatment. The knowledge acquired by the compilation of the freshman and sophomore learning experiences is applied to patient treatment. As juniors, dental students are required to complete patient treatment in the areas of operative dentistry, periodontics, crown and bridge, endodontics, occlusion, partial denture, complete denture, children's dentistry, oral diagnosis, surgery, hospital dentistry, and community service.
Dentistry, I guess the biggest thing about it is it's people business. If you can learn to handle the people and cope with their fears and get them relaxed, it's fun. You find it's like a hobby. You have craft, you do something with your hands, you make it work. People go away feeling happy, they're fixed. You've got a good, satisfied feeling, and if the patient's pleased, then I'm pleased.
The senior year is unique because it requires students to attend classes for 3 semesters. During the senior year, students are required to devote 28 hours a week to patient treatment. This results in several demands placed on fourth-year students.
It's a big, big time commitment. And I think anybody that was interested in coming to dental school would be well advised to realize this. It's not like undergrad where you can say, well, I just need to learn this for now and I can forget it. You have to know this forever. And the closer you get to senior year and the way I am now, you start to think, oh, I don't know this, I don't know that. So the time commitment is very important. It cuts into your social life significantly. Sometimes you don't have a social life. Many times you have to say, no, I can't go, or I'd like to, or you get tickets for a concert or for a play, and there's a big test the next day. Or something doesn't come out, so you cast a bridge and it doesn't work, and you have to spend the evening redoing it. So from that standpoint, you really need to understand that it's not just, it's more than a notion. You have to say, well, these 4 years I'm going to put time in on dental school, and what fun I can get out of the side, will be good.
To provide students with an understanding of the ramifications of practice management, By Design was created. This series invites healthcare professionals from private enterprise to discuss and advise seniors on the development of their dental practice. Topics range from associate practice to office architecture.
There are a lot of problems that we as students face here. There are a number of complaints we register daily, yearly, monthly, weekly, whatever. And I think that's probably going to continue because the administration is really not able to, and we understand this to some degree, not able to bend to all of our whims. However, on the other side, I'd like to say that I think that the education one gets at the University of Michigan has to be an excellent education because it's respected throughout the dental schools and dental profession. When you come from the University of Michigan, you're automatically basically respected because if you've completed that program, it's an evident indication that you have gone through one of the toughest. Now,
another aspect of the summer session of this year provides students with the opportunity to travel to northern Michigan in pursuit of further learning experiences. Senior students volunteer to provide free dental care to migrant workers and their families, utilizing the school's mobile health units.
Some people get by in dental school doing very little studying. I mean, they can read one passage and remember it. Other people have to read it several times, make notes, and still read it more to understand it. So I think it really just depends on a person taking a very good look at himself at the very beginning and trying to evaluate those things that he or she can do and do well, enhance and really get those going. And the weaknesses, try to build up, on the weaknesses. And this can be in study habits, this can be in manual dexterity and motor skills or whatever. When you find out that you've got something going, sure, use it. But if you find out you don't have it going, then try to find a way to approach it to where you can get it going so that you can survive, because that is the number one thing. In all honesty, I think we as students, we're interested in becoming professionals. We also want to render service. But in the long run, it's going from A to B, from the first day to the last day that's most important, surviving.
Each year of dental school is vital. The students must learn the basic sciences in order to proceed with the delivery of patient treatment. The dental students are required to devote time and patience to the learning of their profession.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.